Tell us what you saw and heard from those who are internally displaced.
It was really heartbreaking what I saw. I saw people who've been through a lot, who are devastated, but who are incredibly resilient and fighting forward. A very typical story of what I heard was a woman where fighting had reached near to their area. The family felt like they had to flee. Then they went to stay with relatives that were in Goma, who were very overcrowded. And ultimately, they made their way to the internally displaced camps. Those camps are mostly full. So right now what we see are people building new camps, building shelter on the side of the road, doing whatever they can to be close into the camps, to have a place to sleep. So I saw people really making their way, struggling. These camps are very crowded. There's very limited access to water, sanitation, very limited access to health services, and food prices in Goma at the same time have increased at rapid levels. What I heard the most from people, women and men, were complaints and fears about sexual and gender-based violence. So basically, as women are forced to leave the camps or forced to do things to try to make money to feed their children, they're being taken advantage of, either in the camps, which don't have electricity, may be very overcrowded, may not always be safe, and then when they venture outside. So a lot of people very desperate, struggling to survive.
Tjada, how is your organization responding to that crisis?
We are doing all we can. This is a crisis that is underfunded. The estimates are about 14% of the funding needs have been met. We, in particular, have been very focused on providing clean and safe water for both hygiene and drinking purposes. I was able to see several facilities where we had set up pumping stations directly from lakes and from the lake, and then we're able to fund multiple areas to provide that pump and that water into multiple areas of the camp. We also do help kind of come up with governance around the water and help communities and help those in the camps themselves kind of govern how those water pumps are taken care of. Also a lot of work to provide clean showering and hygiene facilities, psychosocial support where we can to the women and girls who are there. And then importantly, where we have the funding to, we try to provide cash assistance, emergency cash assistance to the people there so that they can, with dignity, buy what they need for themselves and their families, while also trying to stimulate the local economy.
I'm imagining that you probably will toss this to the government there, but what's being done really to stop these atrocities against women, girls, children? And were you able to even speak to some of the men in the IDPs?
Yeah. Not enough is being done, and honestly, without pressure on the government and the armed groups to come together in peace talks, this is just getting worse and worse. In fact, some of the armed groups have started to send missiles into the IDP camps or into areas very close to those camps. So even those camps are feeling very unsafe, and the suspicion is that they're doing that to ramp up pressure for these peace talks. So peace talks are a big part of the solution. Outside of that, we've got to provide safer areas for people, make sure that there's lighting in these camps, that there's access to facilities. And then also we need to increase programs we call like food for work or other things where people can earn an income and help them with economic livelihood while they are still struggling in this situation.